Well, welcome to all our women veterans and all participants in our Women Veterans Town Hall this evening. My name's James Doling. I'm the hospital director here at Edward Hines Jr. VA Hospital. And I want to thank our women's program for putting this together. And I want to encourage all of you to please reach out to them. If you're not already engaged in care, I highly recommend you do so. They do a great job. I do want to give a few highlights. So, again, women veterans, you belong to the VA, the largest and only healthcare system that is designed specifically around you and for you. We continue to expand our services to improve your care so that we can support you in all stages of your life. You have access to a full spectrum of gender-specific comprehensive healthcare at the VA. And our whole health approach is all about focusing on what matters to you rather than what's the matter with you. We take the time to get to know you as a person so we can create personalized health plans based on your values, needs, and goals. Hines Women Health Program is also preparing to host a rural women veterans stand down at Kankakee Community College on Saturday, April 27th. So please mark your calendars. Our Women's Health Program would also like to welcome our new Women's Health Program Manager, Brenda Fritz, who is here today to tell us more about her role. I would also like to take this moment to highlight an important health initiative. February health campaign is Heart Health. The goal of this campaign is to help increase bystander CPR. The rates for women need to increase, and our awareness of cardiac arrest in women needs to increase as well, as they are less likely than men to receive bystander CPR. You don't need to be formally trained or certified to perform hands-only CPR. It's easier than you might think, so please check in with your provider for more information on this. We have a great lineup of people to share information about the services and resources available for women veterans. Next, I'd like to introduce Dr. Hepsi Kalapala, our Women's Health Medical Director. Dr. Kalapala.
Good afternoon. Welcome once again to the Hines VA facility, Women Veteran Only Town Hall meeting. My name is Dr. Hepsi Kalapala. I am the Women's Health Medical Director for this facility. First of all, I would like to thank all the women veterans for their service for the country. Hines VA Women's Health Program has more than 40 providers with several well-trained and with different skills. And you're going to hear at this town hall meeting some of these services and directly from these providers. First of all, I would like to introduce our new program manager, Ms. Fritz. She's going to tell a little bit about herself. Thank you once again. I'm welcoming Ms. Fritz. Thank you.
Good afternoon, everybody. My name is Brenda Fritz, and I am honored to work at the Edward Hines Jr. VA as the Women Veterans Program Manager. My experience spans about 20 years of healthcare work, both clinical and administrative. Life is a journey, and my work started as a registered dietitian at the Cook County Hospital. My interests expanded for me to pursue my master's degree as a physician assistant and also in business administration. The Veterans Health System is one of the best in the United States, and that's for you, the women. I've experienced this both as an employee and as a family member who utilizes several VAs across the country. Over the past several years, I have had the great experience to work at the Jesse Brown VA in the Homeless Primary Care Clinic and also in their emergency department. Clinically and administratively, I worked at Madison VA in Wisconsin, and there I worked in employee health, taking care of many veterans who are also employees. We all experienced the pandemic, and I also helped with the pandemic care for our employees so that we can support our veterans throughout the nation. As the Women Veteran Program Manager, I will work to ensure that women receive timely, equitable, and high-quality comprehensive health care in a safe and quiet environment. Thank you.
Hello, I am Marissa Reese, and I'm the Maternity Care Coordinator. The number of veterans using VA maternity benefits has increased by more than 80% since 2014. Maternity benefits at the VA include physical exams and lab tests, perinatal education, ultrasounds, genetic testing, prescription drugs, newborn care for the first 7 days of life, lactation support, social work, and mental health services. The maternity care is contracted to OBs and midwives in the community. Maternity care coordinators help veterans navigate healthcare services both inside and outside of the VA. They help veterans access care for physical and mental health needs. They connect veterans to community resources. They help veterans cope with pregnancy loss. They help veterans connect to care after delivery and answer questions about billing. The maternity care coordinators also provide case management to the veterans throughout their pregnancy and for a full year after the delivery of the baby. They screen pregnant and postpartum veterans for social determinants of health, such as tobacco and alcohol use, food insecurity, mental health risk factors, and relationship health and safety. Hines also offers ROSE classes for pregnant and new moms. This is a group class that we offer via telehealth. Participants receive education about self-care, dealing with feelings that arise with new motherhood, managing stress in relationships, and how to plan for the future. In October 2023, maternity care was expanded to align with President Biden's initiative to lower the incidence of maternal infant death in the United States. We now provide continued care coordination for veterans and their babies for a full year after delivery. Doubling the amount of contact with veterans helps to improve the physical and mental health of both parent and child. Thank you.
Hi everyone, my name is Karen McLean. I'm the clinical nurse manager of the Women's Health Clinic here at Hines. And I'm here to talk to you all about our personal care pantry. This is something that we invented in women's health. It's a shelf, a storage shelf that's kind of marketed after our Hines food pantry, except it's for personal care items for women. And this is mostly to address the issue of period poverty. Period poverty refers to the increased economic vulnerability of menstruating people that they face due to the financial burden imposed by purchasing menstrual supplies. Difficulty affording menstrual products can cause women to stay home from school or work, with lasting consequences on their education, their work life, and economic opportunities. It can also exacerbate existing vulnerabilities, pushing individuals closer towards dangerous coping mechanisms. Period poverty has also been associated with mental health issues and urinary tract infections. The Women's Health Clinic staff are advocating for women veterans to have access to personal and self-care items. So we are taking donations. There are some some community partners that have provided donations to us of personal care items such as period supplies, tampons, maxi pads, panty liners, menstrual cups. Also incontinence products such as Depend undergarments or Poise pads, as well as some toiletry items, some self-care items, shampoo, conditioner, body wash, body lotion. Our pantry is located in the waiting room of the Women's Health Clinic on the 12th floor in Building 200, and it's open to all women veterans who might benefit from those supplies. You're more than welcome to come and check it out. Thank you so much.
Okay, my name is Lisa Marcino, and I'm the pelvic floor physical therapist at Edward Hines VA Hospital. And I just want to tell you a little bit about my role here in the Women's Veterans Health. So as far as with pelvic floor PT, what we specialize in is focusing on pelvic floor conditions or disorders, really in regards to specifically the pelvis, and I'll get into a little bit more of those conditions. We take a look at muscles, ligaments, nerves, different things like that as well. And some of those conditions that we treat would be like urinary leakage or what we call urinary incontinence. Some of those can include stress incontinence or urge incontinence, functional, different things like that. Also pre and postpartum, even during pregnancy, I definitely see patients there as well. If we have any pelvic organ prolapse, any pain with intercourse, any bowel leakage or things like that, constipation or other conditions that we work on too as well. Anything pre and post-surgical, maybe such as a hysterectomy, things like that, are things that we can also be included in some of those conditions. So what a treatment would look like can be a bunch of different exercises, and maybe including some diaphragmatic breathing techniques, some abdominal strengthening, maybe some glute strengthening. Sometimes we need to learn some relaxation techniques too as well. So those would include some more of those breathing techniques, maybe different types of stress management and meditation, things like that. And that would help us provide referrals to other resources that we can provide too as well. We also have equipment that we can order too as well. Sometimes we have tightness in certain muscle groups, and that can create a lot of pain, and sometimes we can have weakness there as well. So some equipment that we can order are dilators, some pelvic floor wands, and some biofeedback machines for at-home use to just help with your exercise program that's along. We also do internal and external treatments and techniques there as well, such as manual techniques and soft tissue massage and things like that, to really maybe help break up some scar tissue following the surgeries.
Hello, good evening. My name is Kate Colangelo. I'm a psychologist here at the Hines VA, and I'm here to talk with you a little bit about some of our opportunities for mental health services for our women veterans. First, I'd just like to address and acknowledge the importance of specialty care services for our women veterans. I've been fortunate to work with women here at Hines for about 6 years, and that's not only in the provision of care that I provide, but also attending women's focus groups and group therapy classes. And from that, I've learned the importance of inclusivity and visibility here at Hines for our female veterans. While women have access to the full range of mental health services here at Hines, which includes substance use disorders treatment, focuses on trauma services, general mental health, sleep-related concerns, or pain-related concerns, to name a few things, we also know that women present with needs that are specific to our gender identity as being women. And especially for women who have already navigated the male-dominated system within the military and transitioning to a VA healthcare system, which was originally established for men. Well, let me say now that our care is your care. We have worked really hard at Hines to develop gender-sensitive and specific services for our women and transgender female veterans. This is why we've developed specific programming to focus on the unique needs of being a woman and the impact on our health and well-being. So we see you, we hear you, and we are here for you. We are fortunate to have an outpatient mental health team that specifically focuses on reproductive women's mental health, which I'll talk about in just a minute. And we also have co-located services in our women's health clinic, which Chloe will tell you about in a few minutes. So first and foremost, our women's reproductive mental health team. We are an outpatient treatment team that focuses on gender-specific and reproductive link events that happen across our reproductive health system. So this can start as early as conception planning, premenstrual mood disruptions, infertility struggles, perinatal and postpartum period, reproductive traumas and pregnancy losses, all the way up through perimenopause. And the important part here is that we know there's a really important intersection between our reproductive health, thanks hormones as women, and our mental health. And we want to be able to provide those services that account for that intersection and do it from a trauma-informed and gender-sensitive lens to provide the care for our female veterans here at Hines. We offer both psychiatric consultation, evaluations, and ongoing care with our team of psychiatrists, as well as individual therapy services with the therapists that are on our team. We also offer a range of different female veteran-focused groups across the service line here at Hines. And so Marissa already shared with you about our ROSE group, which is focused on prevention of postpartum depression. We have a women's only MST group. We have a women's with disabilities group. We have a women's focused group for our addiction treatment program. We have a group called Superwoman Revamped, which is focused on the experiences of women of color. We have a Strength at Home group, which I think Erin will probably be talking about soon. And then we also have a number of peer support groups that our peer support specialist, Sonia, will be sharing with us in just a few minutes as well. Lastly, I'd just like to take this opportunity to share an opportunity. So for anyone that might be listening now and is interested in wondering, how do I get involved in not only receiving mental health care here at Hines, but also how can I be a strong advocate for the development of care here at Hines? We have a Women's Mental Health Advisory Board, and that board is specifically made up of both staff members and also veterans. And the opportunity here is to share your experience, to be an important and integral part in the development and expansion of our women's mental health services. And we are always looking for new members to join. So if that's something that you're interested in, please connect with your provider, and I'm happy to link you with information about that. Thank you so much for your time tonight, and thank you for your service.
Hello everyone, my name is Sonia Ebel-Timmon. I am one of the lead peer specialists here at Edward Hines Junior VA. I am here to talk to you about peer services. Before I begin, I want you to know that peer support or peer specialists are veterans themselves who have navigated VA systems either through mental health or substance use and primary care. And our job is to come alongside other veterans to help them also navigate the system. We also partner with our medical providers to ensure that the needs of the veterans are being met. With that, peer specialists have the opportunity to see veterans individually or in groups with a referral from a provider. And I want to talk to you about a few of the groups that we have specifically for women. We have several recovery-focused groups. I'll start with Confident and Courageous, a long-standing group here at Hines that is currently getting ready to be piloted nationally. That is a group of women veterans who come together to support each other in their individual goals, and it also has a community integration component. We also have Crafted Wellness. Crafted Wellness is one of our new groups created and facilitated by one of our peer specialists, Priscilla Hall, who is also in the community. It deals a lot with community partners in our whole health areas. And then we also have Woven in VA. Woven in VA is an adaptation of a community organization, Women's Veteran Network in the community. And the group here in VA is designed to help you bridge to the community from VA. We hope that you will join us in some of those groups and
for our women in our different clinics, do not be alarmed. All of these groups are being prepared to visit you in your particular clinics. So that is our project for this year, and we look forward to meeting and serving you, and thank you all for your service. Next, I will turn it over to Erin Harahan, our Intimate Partner Violence Coordinator.
Thank you, Sonia. Well, let's see if I can change my slides. See if I can change the slides. A little more. Towards the end. Okay, thank you. So I am Erin Hannerhan. I'm a licensed clinical social worker and also our Intimate Partner Violence Program Assistance Coordinator. Our mission in the IPVAP program is to provide comprehensive programming for veterans, their partners, caregivers, and VA employees who are impacted by domestic violence. Within our Intimate Partner Violence, we offer a variety of services that I quickly want to go over. One is offering support and education to helping to identify healthy, unhealthy, and at-risk behaviors. We also offer safety planning, assessment, and screening for IPV, again, intimate partner violence or domestic violence. We offer referrals to resources within the VA and also domestic violence community resources, and then also provide a couple clinical interventions. The first one is RISE, which stands for Recovery from IPV through Strength and Empowerment. This is an 8-week individual therapy that a patient can choose the certain modules that they want to address that are affecting their relationship. We also offer our Strength at Home program for veterans, which is it's a group intervention for veterans that are using anger, aggression, or violence within their intimate partner relationship. And then we also offer Strength at Home Couples, which is an 8-week group intervention with multi-couples that works on addressing conflict and increasing communication. If any of those services are of interest to you, please reach out to the phone number that you see here, which is directly my line, 708-202-7243. We learn from our veterans that they believe that it's important in our healthcare system that we should be asking about your relationship health and safety. And we've begun to do that to help you improve your physical and mental health. Consistent with our current VA policy, we now have begun annual screening, which is our relationship health and safety screening, that will be activated for all women veterans who are 47 years of age and younger. This will be an annual screen that will be able to provide resources and referrals to our IPVAP program and also community resources. Eventually, this screen will be rolled out for all veterans, but we are starting with women. I lastly want to mention this universal sign for help. The Department of Veterans Affairs has adopted this universal sign for help, and the universal sign for help is a nonverbal way that a person can privately and discreetly request help. So the universal sign is a discreet hand gesture performed by one hand, tucking the thumb and folding the fingers over. And that again will allow somebody to know that you may be in a situation where you feel unsafe, you may need help. The signage is going up. It is an action item for our facility, so you will see all of this signage in the public restrooms. When you click on the website or you scan the QR code, you'll see to the right, you'll see the resource page that'll pop up where you can access any of those resources, again, for mental health, medical emergency, domestic violence, human trafficking, or sexual assault. I want to thank you for your time today, and I want you to reach out to the Intimate Partner Violence Assistance Program if we can be in additional help. Thank you.
Hi, good afternoon. My name is Chloe Serpico, and I'm a social worker within our primary care behavioral health program, other known as PCBH. And within our PCBH program, we provide co-located collaborative care services to our veterans in the primary care clinic. And this consists of mental health and behavioral health services. On our team, we have a wide range of providers such as social workers, nurses, psychologists, psychiatrists, and peer supports. We have some services that we can offer to veterans, specifically individual therapy as well as group therapy, virtual, and in person, whatever your preferences or needs are. We treat a wide range of disorders that can range from anywhere from stress to anxiety, depression, or coping with cancer and chronic pain. These can range anywhere from 30 minutes that can fit into your schedule, and it usually is around 4 to 6 sessions in length. We're able to fit into veterans' busy schedules if you're working late as well. We offer a wide range of groups and classes that can help you get connected with veterans that may be experiencing some of the things that you are experiencing as well. We're located on the 12th floor within your PAC teams. When you're seeing your primary care provider, we can see you the same day that you are in the clinic as a warm handoff. And if you'd like to address any of these behavioral health concerns, you can just let your provider know. We can act as a guide to navigate this wide range of services that are offered within the VA that can kind of be confusing and help you pick the best treatment for yourself. We also offer phone-based support for veterans that may be starting a new mental health medication or changing their mental health medication that is managed within your primary care clinic. If you're interested in any of these services, you can let your primary care provider know, or when you are in with your primary care provider, you can ask for a warm handoff to see one of our clinicians. Thank you.
Thank you to everyone who joined us. Before we end today, we do want to invite a very special guest with us today. Mr. Ward, can you come up here? And while you're doing that, we want to thank you for your support of this Women's Veterans Town Hall and what you do here at VA. The floor is yours, sir.
Good afternoon, ladies. For those who are with us remotely and electronically, I don't know if you paid attention, but you're very important. Last year, the Secretary of the VA, well, I'll go back a little bit. How many have come in the front door of Hines and looked up at the wall in Building 200? Abraham Lincoln made a statement, in 1863, to care for him who has borne the battle, for his widow and his orphans. That excluded you women. Last year, the Secretary of the VA amended that statement. And if you look now, it's there, it says, to care for those who have borne the battle, for their survivors and their children. Believe it or not, women are the largest growing segment of veterans in this country. So I wanted to come and say welcome. I am the president of the Patient and Family Advocacy Council. I sit on the Mental Health Council. I'm everywhere like underdog, for those that remember that. If you have a question and you see me in this hospital, please contact me. Contact any of these ladies who is sitting here, any of the ladies in your clinic. If they don't know who I am, they're hiding in the cave, because I'm everywhere. And I want to support you and welcome you to the Hines family. Now, the Patient and Family Advocacy Council, we're about 13 people. And we listen to complaints that veterans have around the hospital. Please, don't tell me about how bad the phone system is. I've been beating that dead horse for 2 years. One of these days we may get it fixed that we can actually get a phone call from point A to point B without 15 stops in between. I'm not hoping for it. However, if you see me walking around this hospital and you got a question, and I don't care how off the cuff it is, stop me. Generally within 1 to 2 phone calls, I can get an answer for your question. And don't ask me for a movable sidewalk, because I want it first. But I'm here to welcome you and to say that There are men veterans here who are looking out for you. I don't want you to be in our hospital and feel uncomfortable because some knucklehead male does or says something that makes you uncomfortable. Contact the patient. Contact the Patient Advocate Council or the Patient Advocate's office immediately. If it's an employee who has one of these ID badges on, get that man's name, because I want to know about it. We have some dinosaurs here who will never learn. But the only way we can teach them is like training a mule. A 2x4 across the nose seems to work. But I welcome you all. I'd love to see and interact with you ladies as you come into the hospital. And you can get my contact information from Lisa and everybody here. They all know who I am. Thank you and welcome aboard.
Thank you, Mr. Ward, and your Advocacy Council for the support for our women veterans. Ladies, what better way to end the Women's Town Hall but to know that you have the support and you have people here at Hines who are diligently working to make sure that your needs are met. You belong here. Thank you for your service.